Have you started noticing white patches on your skin? Maybe it's around your mouth, your hands, or your eyelids, and they just keep getting bigger. They don't itch, they are not painful, and they are very visible. You may have tried different creams, but nothing seems to work. This could be more than just dry skin or pigmentation. It could be vitiligo. Hi everyone, I'm Dr. Edmond here from EC Skin Laser Aesthetic Clinic located in Penang, Malaysia. Welcome back to my channel. Today we are talking about something that affects a lot of people but often get overlooked: vitiligo. If you notice white patches on your skin and don't know what's going on, stick around because we'll explain what it is, why it happens, and most importantly, how to treat it. What is vitiligo? Vitiligo is a long-term skin condition that causes the skin to lose its color or pigments. It happens when your immune system mistakenly attacks your melanocytes. These are the cells responsible for producing melanin, the pigment that gives you your skin color. And once these cells are damaged, the skin loses its color in patches. It can happen to anyone, any skin tone, at any age. For some people, it started very slowly. For others, the progression can be quickly. Some patients get a few patches, some see it spread to larger area over time. So, why does it happen? The exact cause of vitiligo is not 100% known, but we do know a few things. It can be linked to genetics. If someone in your family has vitiligo, your chances may be slightly higher. It also associated with other autoimmune conditions such as thyroid diseases, and it can be triggered by things like severe sunburn, stress, or even skin injury. The thing is, vitiligo is not contagious, and it is not due to poor hygiene or food, but it could change the way your skin looks, and it can take a toll to your emotion. Many of my patients with vitiligo come in not just because of the white patches, but because they are starting to avoid mirrors. They are covering up more than usual, and they are pulling away from attending social events, or even feel afraid to pose a selfie. I want you to know that your feelings are valid, and also there are options. You do not have to just live with it. While there is currently no permanent cure for vitiligo, we do have very effective ways to manage it in many cases, restoring pigments. Here are a few options I often recommend depending on your skin type and vitiligo stages. Firstly, topical medications like steroid creams or non-steroidal creams like calcineurin inhibitors can help stop immune response and sometimes trigger repigmentation, especially if the patches are still new. Laser treatment like the Excimer UV laser is a more targeted form of light therapy for smaller area and very useful for facial white patches. And these are an important tool to repigment the skin. Thirdly, oral medications and certain supplements. In some cases, we might need to use certain oral medications and supplements to control and strengthen your immune system to treat vitiligo. Most importantly is to consult a doctor before embarking on treatment with vitiligo. At Easy Skin Laser Aesthetic Clinic, we take an individualized approach when managing your vitiligo. We assess your vitiligo stage, look at how active or stable it is, considering your lifestyle and skin goals, and then we design a combination treatment plan just for you. Whether it's topical creams, laser treatments, or oral medications, the most important is we will monitor your skin progress closely and we adjust our treatment according to your skin response. If you or you know someone suffering from vitiligo, I want you to know that there is hope. I've seen many patients regain their pigments, their confidence, and their peace of mind. It's not an overnight fix, but with the right support, it's possible. If you'd like to learn more or speak to us about your skin condition, we are here to help. And if you find this video help you understand your skin a little better, give it a like, subscribe, and feel free to share it with someone who might be going through the same thing.